What is the cardiac arrest? Which sports have got the highest risks? What are the causes of such arrests and what are the preventive strategies for athletes?
Hello everyone, welcome to the Lancet Summary YouTube channel. In this channel, we summarize a medical hot topic recently published in the Lancet journal. Today, our special guest is Dr. Maryam Abolhassani, an associate professor at Tehran University of Medical Sciences, specialized in sport medicine. And as you know, Dr. Abolhassani was our guest in another video called Stay Active at Any Age. Dr. Salamati, could you please tell us what we are going to talk about today?
Sadly, a couple of weeks ago, Mr. Ratiq Zarei, who was one of our master athletes, passed away during soccer in Fars province. Surprisingly, he was the sixth athlete who died during soccer in that province. Last year, Thomas Lockyer, who is a famous Wales national soccer player, and Damar Hamlin, who is an American football player from Buffalo Bills, had such arrests, but happily both of them were survived. You know that sudden cardiac arrests and death can happen sometimes in athletes, both in competitive sports and in recreational physical activities. However, when this occurs among youth, it can attract international attention. But more importantly, we ought to know that most of them are preventable.
Dr. Bahri, would you please define sudden cardiac arrest and tell us the difference between sudden cardiac arrest and heart attack?
Sudden cardiac arrest happens when the heart unexpectedly stops beating, cutting off blood flow to the brain and other vital organs. In athletes, this can occur during or right after the exercise, often due to hidden heart problems that haven't shown any symptoms. It's important to know that sudden cardiac arrest is different from a heart attack. A heart attack is caused by a blockage that stops blood from reaching cardiac muscles, while sudden cardiac arrest involves a sudden failure in the heart's electrical system, causing it to stop pumping blood effectively.
Dr. Abolhassani, which sports carry the highest risk for sudden cardiac death?
Sudden cardiac death can occur in any sport. Deaths among young individuals occur most frequently in the most popular dynamic sports with a start-stop nature, notably in basketball in North America and soccer in Europe. Other groups at high risk for sudden cardiac death include men's soccer and men's American football. It's generally accepted that physical exertion through athletic participation triggers potentially fatal ventricular arrhythmias in predisposed individuals. This data supports a targeted and more intensive screening program for the athletic community.
Dr. Bahri and Dr. Salamati, how common are these accidents?
Although rare, sudden cardiac arrest is the leading cause of death related to exercise in young athletes. Estimates suggest that sudden cardiac death ranges from 1 in 40,000 to 1 in 80,000 athletes per year.
We can categorize athletes into two different groups. First, those who participate in competitions and are less than 35, and we can name them as young competitive athletes, and those who are equals or more than 35 and they participate in competitions or they have intensive recreational physical activities, and we can name them as master athletes. Scientists predict that sudden cardiac arrests and deaths are 7 to 10 times more often among master athletes than competitive young athletes.
Dr. Abul Hassani, what are the causes of sudden cardiac death in structurally normal hearts?
Most conditions predisposing to sudden death in athletes occur on the athletic field. Primary ventricular tachyarrhythmia are the predominant mechanism of sudden cardiac death in these inherited conditions, except in Marfan syndrome, where death is often aortic rupture or dissection. The age of an athlete is strongly associated with the etiology of sudden cardiac death. The cause of exercise related sudden cardiac death in master athletes over the age of 50 years old is coronary artery disease, which accounts for over 80% of fatalities. Approximately 50% of middle aged athletes who die suddenly from atherosclerotic coronary artery disease have prodromal symptoms suggestive of myocardial ischemia, and many have significant risk factors for coronary artery disease. In contrast, sudden cardiac death in younger athletes less than 35 years old is most commonly due to a variety of hereditary or congenital structural and electrical cardiac abnormalities, although a plethora of acquired conditions are also implicated.
And what are the markers of high risk potential for sudden cardiac death?
Once a diagnosis is established, the risk of fatal arrhythmias during normal life activity can be predicted through a risk stratification process that includes symptoms and family histories, exercise stress tests, and 24 hours Holter monitoring. Markers of high risk sudden cardiac death include unheralded syncope, history of sudden cardiac arrest, family history of sudden cardiac death, smaller than 40 years old, severe left ventricular hypertrophy, more than 30 millimeters, non-sustained ventricular arrhythmia, and decreased blood pressure in response to exercise.
Dr. Salamati, what do you recommend as primary preventive measures to prevent these accidents?
In young competitive athletes, firstly, we should get them a targeted history about having the related symptoms, or have they ever got such accidents in their families. In the next step, we should get them a medical physical exam, and finally, they should do an electrocardiogram, and we should interpret the electrocardiograms precisely. Of course, some experts recommend more evaluation. Nonetheless, there is no consensus for such further assessments. And in master athletes, we should pay attention to previous cardiovascular disease history. If they have such histories, they should consult with their cardiologists. And if they don't have such positive histories about cardiovascular disorders, in addition to what I said before about young competitive athletes, we should review them based on the related risk factors of coronary artery disease, such as smoking, diabetes, and obesity. If they have such history, then in the next step, they should do exercise stress testing.
And what should be done as secondary preventive measures in society?
Actually, all schools and competitive sports must have emergency action plans, including cardiopulmonary resuscitation training and having access to defibrillators, and do sometimes drills to ensure that all related people have been taught correctly. Also, the plan should include that how to transport such patients into the nearest hospitals. In this video, we talked about a paper entitled A Contemporary Review of Sudden Cardiac Arrest and Death in Competitive and Recreational Athletes, which was published in 30th November 2024 in the Lancet journal.
Thank you all for your thorough explanations. Once more, the goal of this YouTube channel is to discuss a medical hot topic recently published in the Lancet journal. Don't forget to like this video, leave your comments below, and subscribe to our channel.